what are the main treatment options for AML, and what are the goals of those treatments?
The goal of treatment with AML is to help the patient live as long as possible, as well as possible. In some cases, in many cases, cure is a realistic goal, and cure means the disease goes into remission and never comes back. The patient gets old and dies of something else without the AML ever coming back. Remission means that the disease has improved, but isn't synonymous with cure. The first decision that has to be made in a patient with AML is the patient a candidate for any treatment beyond just supportive care? For instance, patients who are very elderly or who have major medical problems, very bad heart, lungs, they may not be candidates for really any type of chemotherapy or stem cell transplant. And so they may just receive blood transfusions or very low intensity therapies. The second decision that has to be made is the patient a candidate, and do they want intensive treatment or low intensity treatments? Patients, especially those who are above age 70, may still be very good candidates for therapy, but not necessarily for the most intensive therapies that would be appropriate for a 20 or 30-year-old. Those type of treatments are often the DNA hypomethylating agents, we call them, decitabine or azacitidine, which may be combined with a pill such as venetoclax or another agent. Among those who are candidates for and who are agreeable to receiving intensive therapy, that is divided into different stages. The first phase of intensive therapy is usually done in the hospital. It's usually a combination of high-dose chemotherapy with the goal of obtaining a remission. Once a remission is obtained, then the next step is to decide, is this disease likely to be cured by a few more cycles of chemotherapy, in which case that's the branch point a patient might go down, or is the only realistic way for cure a bone marrow or stem cell transplant, in which case that's the direction in which one goes next. Once the disease has relapsed, if it does so, then there are some additional therapeutic considerations, such as what are the specific genetic markers. But in general, that's how patients proceed. They're either candidates for supportive care alone, low intensity therapy, or more intensive therapy. And each of those has sort of different stages of therapy.